How do you interpret MoCA test results for dementia? Have you ever wondered how healthcare professionals interpret the results of the Montreal Cognitive Assessment, commonly known as the MoCA test, when it comes to dementia? The MoCA is a valuable tool used to evaluate cognitive function and detect cognitive impairment, including dementia. It assesses various cognitive domains such as memory, executive function, attention, language, visuospatial skills, and orientation. The test is scored out of 30 points, with higher scores indicating better cognitive performance. A commonly accepted cutoff score for the MoCA is 26 points. If someone scores 26 or below, it suggests possible cognitive impairment, which may indicate mild cognitive impairment or dementia. However, this cutoff is not absolute and should be interpreted carefully in a clinical context. For instance, some individuals without dementia may score below 26, leading to false positives. Conversely, some individuals with cognitive impairment may score above 26, resulting in false negatives. This highlights that MoCA results are just one part of a broader diagnostic process and not a standalone diagnosis. When interpreting scores, those between 19 and 25 often indicate mild cognitive impairment. This condition can be a precursor to dementia, but it does not always progress to it. Scores around 11 to 21 are more typical of mild Alzheimer's disease or mild dementia. A score below 18 may indicate moderate to severe dementia, although there is overlap, and clinical judgment is essential in these cases. The MoCA test is particularly sensitive to early cognitive changes and is generally more accurate than older tests, like the mini mental state examination, for detecting mild impairments. However, it cannot differentiate between types of dementia or definitively diagnose dementia on its own. In clinical practice, the results from the MoCA guide healthcare professionals in deciding whether further, more detailed neuropsychological testing or medical evaluation is needed. It's important to consider factors such as the person's age, education level, language, and cultural background, as these can all influence scores. In summary, a MoCA score of 26 or below signals the need for further assessment for dementia or other cognitive disorders. However, these test results must be integrated with clinical evaluation and other diagnostic tools to confirm a diagnosis and plan appropriate care. If you or someone you know is concerned about cognitive health, it is always best to consult a healthcare professional for personalized advice and assessment.